So let's raise the big questions. What should be India's vaccine strategy? Who will get the vaccines first? Do those who recover from COVID need vaccines? Can India produce enough doses of vaccines? How much will India's vaccine mission cost? Some of the questions that we will try and raise. I'm joined by a very special panel of experts. Joining me now is one of the country's leading virologists, Dr. Shahid Jamil. He's with also Ashoka University. Professor Ramanan Lakshmanan joins us. And I'm also joined, Lakshmi Narayan joins us, Director, Center for Disease Dynamics, and also Dr. Shashank Joshi, member of the COVID Task Force in Maharashtra. Appreciate your joining us. Dr. Jamil, I want to come to you because you've just written an interesting article where you've said while the news of the vaccine coming soon is encouraging, the devil remains in the details. Can you explain that to our viewers? What are these details that should worry us as we look forward to a vaccine possibly in the months ahead?
Well, when I was referring to the devil, it's the planning. Do we have a distribution plan ready in the sense that we know who to give the vaccine to when it comes? So what we are hearing is that vaccine will be first given to people who are on the front lines. So, for example, healthcare workers and, sanitation workers, service people, and also people who have comorbidities and people who are elderly. What we haven't figured out is, will we give vaccine to somebody who has already been exposed? So that was really the question I was raising. If doses are going to be limited, should we not give it to people who have not been exposed? Because there's going to be no added benefit giving vaccine to somebody who has already had a natural infection. And certainly healthcare workers deserve the vaccine ahead of, first. But what if that healthcare worker has already had a natural infection? So to do that, we'll have to test. And the point I was raising is that if the test to find out antibodies cost the same as the vaccine, then economics will demand that you just blindly give the vaccine. And that is going to waste precious resource. So that's really the point that I was raising, that we need to really discuss this at the highest level, plan and have a strategy ready by the time the vaccine comes.
So let me get it very clear once again, Dr. Jamil. You're saying that those who have already been affected in the last several months may not need, in your view, the vaccine. They need not be priority, whether then they are frontline health workers or elderly or indeed the young. You're saying the focus should be on those who have not been infected. Am I correct?
Yes, because vaccine cannot beat natural infection for immunity. And if natural infection hasn't given you immunity, the vaccine is unlikely to do so. That's the whole point that I'm trying to raise.
Okay, that's an important point because Professor Ramanan Lakshmi Narayanan, I know you've been speaking about herd immunity for a long time. Now, let's assume that 60% coverage is needed for herd immunity. India would therefore have to vaccinate about 800 million people, assuming it's a 2-dose vaccine. That's about 1.6 billion doses. That's a lot of doses, even though a number of companies are in the race. Do you sense, therefore, that this process is going to be much longer than perhaps we are anticipating today?
Rajiv, it's going to be longer for two sets of reasons. One is, although there's a great deal of optimism about the Oxford vaccine, and a lot of it is warranted, there are still open questions about that vaccine. First of all, we don't have all the data from the clinical trials. It's unclear why giving half a dose followed by a full dose a month apart gives you 90% protection, whereas giving a full dose followed by a full dose a month apart gives you only, 60% protection or 62%
62%,
protection.
yes.
Yeah, that just seems, it seems strange why that would be the case. So I think we're all happy, but I think we need to see details of this, and also in terms of two other important questions, which is, one, which age groups does it protect? If it only protects some age groups, we have some preliminary evidence apparently that it protects the elderly, which opens up another category. but we don't know if the vaccine is safe for children, which is an important question. So that immediately lowers the number of people that you can vaccinate with this vaccine at the current time. The second part is duration of protection. Now, let's say the duration of protection is only for 3 or 4 months or 6 months. That changes the equation quite a bit compared to a duration of a lifelong or at least for a year. So, although there's room for optimism, there are questions of this sort. The second part is really to do with delivery, as Shai just mentioned, and here the questions are really around one is affordability. Even at say 250 rupees, which works out to something like $3-4 a dose, you're talking about, as you said, something close to about $8 billion for just the vaccine alone. Now that works out to roughly 48,000, if I have the numbers right. 8 billion is roughly what the government spends, the central government spends on health. So it's a massive amount of money, and there are going to be questions about whether the government should pay for everybody, or whether people above BPL or people above a certain income level can afford to pay for themselves while we prioritize the vaccine for the poor who are unable to pay for themselves. So I think there are multiple lenses on prioritization.
Right.
The epidemiological lenses are some, but I think the equity lenses are going to be also very important, because we owe it to the poor to protect them against a disease that they weren't traveling to China or Italy. They need to be protected.
So what you seem to be suggesting is that the BPL families should get it free of cost, at least at the very outset. At least that commitment should be made. Remember, before the Bihar election, the government said everyone would get it free. Now, when the Prime Minister today was asked apparently by a Chief Minister about costing, the Prime Minister said that we haven't yet looked at that, nor have we looked at exact timelines. I'll come to that in a moment, because Dr. Joshi, one of the other things the Prime Minister said at the meeting today was apparently to the Chief Minister that you need to start setting up localized centers. This will have to be decentralized. Do you believe the fact that we've had so much of experience in dealing with polio campaigns in the past will come to India's aid? Do you believe we have the infrastructure today, Dr. Joshi, in states like Maharashtra, indeed across the country, to be able to ensure that this whole process gets expedited once the vaccine is there?
Rajdeep, that's a very good question, and I completely agree that we have probably the infrastructure and capabilities to vaccinate. We have been complemented both in the smallpox eradication program and in the oral polio eradication program by WHO. Remember, India produces world's half vaccines, and therefore I think we have, in pediatric space, we have clearly been leaders on planet Earth. Now, in adult space, we need a vaccine preparedness program, which has to be a very calibrated, scientific, science-driven, rational program. And I am reasonably confident that we will be able to execute it in a very logical, systematic way. Under the Niti Aayog chairmanship of Dr. Vinod Paul, we have a vaccine preparedness team, which has looked at it for the last 2 months and will continue looking at it and guiding the states so that this can be done. But the states will have to have its own infrastructure under the chief secretaries so that they can ensure the storage, the transportation, the administration, and the delivery of the vaccine to the right candidates and the right cohorts is done in a very mindful and a systematic way. And that is something which can be done. It is doable. We have had successes in other vaccine programs, particularly in polio, in smallpox, and many other vaccination programs. So I'm quite confident that we can do it.
But Dr. Jameel, as someone who's tracked this, is this very different? The challenge posed for a coronavirus, is that very different to the challenge that was posed, let's say, by the oral polio vaccine?
Absolutely. The oral polio vaccine came in a little vial, a little plastic bottle, and you put 2 drops on the tongue. This is going to come in vials, which will require a syringe and a needle. So it completely changes the dynamics. The polio vaccine could be given by any untrained person. An injection cannot be given by any untrained person. India's capacity to vaccinate is about 15 lakh doses a month. If you convert that into the number of doses that will be required to vaccinate 60% of the population, it will take 9 years for us to do that. So therefore, it is important that we build that capacity, we ramp up that capacity, and ramp it up pretty quickly. I mean, it's not
can you throw those numbers at us? Sorry to interrupt. Can you just throw those numbers, because I think viewers need to understand this. Can you just explain that? India's capacity, you're saying, is 15 lakhs doses per month?
That's right. The present capacity to vaccinate in the immunization program, that's 15 lakh doses a month.
Right.
And if you translate that into covering 60% of India's population, which is 800 million people, then you will take 9 years to vaccinate everyone at this rate. So it's not just the amount of vaccine that's available, it's also people who are trained to administer the vaccine, the logistics. The logistics are going to be incredibly more complicated than giving a pulse polio vaccine. India has done very well. I don't disagree at all. I mean, I'm actually very reassured that I live in India, which has this capacity to make vaccines and deliver vaccines in the last mile. But just because we did it for pulse polio, thinking that we can do it here, we need to take a very, very hard look at it. The dynamics are completely different.
Is that just one statutory warning you're giving us? Is there anything else, Dr. Jamil, that we should look at? Because, this general celebratory mood in the last week, I think, needs to be tempered by realities, and you're giving us a reality check. Any other reality check that you want to give us today?
Well, the other reality check is going to be about the manufactured doses of vaccine. Certainly, India supplies the world, half of the world's capacity of vaccines. India makes roughly 3 billion doses of vaccines a year, out of which 1 billion is consumed internally and 2 billion is sent outside. If you look at the COVID vaccine manufacturing capacity, we are likely to reach about 60% coverage at this rate in about 2 years' time. So again, that's a reality check. Everyone should not think that they will get the vaccine as soon as it comes out. We are looking at the numbers of 3 main companies, Serum Institute, Bharat Biotech, and Zydus Cadila.
Right.
So that's roughly 800 million doses in a year.
That's right, because Serum says it's looking at 400 million doses. Of course, 800 million doses, of which 50% will be available for India, 300 million from Bharat Biotech, 100 million from Zydus Cadila. So the numbers are impressive, but as you say, it will take time. And I think that's one of the challenges. Also, in prioritizing, Dr. Joshi, you're part of the COVID task force in Maharashtra, and I'm told Uddhav Thackeray today at the meeting said he's already in touch with Serum Institute, which is Pune-based. But the worry is that are we aware of the logistical challenge that is required? Because even today we are first battling COVID virus. Let's be clear. There's a second wave or a third wave in some parts of the country. Do you believe that we have the logistics already in place, Dr. Joshi, or will it require time?
Well, I think I'm the optimist of the group. I'm not as pessimistic as Dr. Jamil. I think we are in disaster times. We are not in usual times. What he's talking is in usual times when there are no pandemics. And during a pandemic time, India has capability, ability, as well as the infrastructure which can be ramped up overnight to manage this administration. The first thing which we need to look at is to look at the efficacy and safety of the vaccines on emergency use, whether in the interim results it is robust. And once that is there, then I think we have a preparedness plan in place which will be able to execute it in a very calibrated, systematic manner. I am extremely confident that in 8 to 9 months, we will be able to vaccinate a large cohort of the population. We can't make these predictions whether it will be 60% or 50%, but I think all the groups which need protection will get protection, and eventually the whole country will also get protection. That might take a little longer time.
Because, the Union Minister for Health and Family Welfare said that India will vaccinate 250 million people by 2021, which means 500 million doses, Professor Lakshmi Narayanan. Is he being optimistic or is he being realistic in your view?
If we are able to get the vaccine at the stated efficacy and the quantity that is being promised, I think it is doable. I certainly think that if we rely on our childhood immunization program, it's not going to happen because pulse poll, you have to remember, is for 25 million children a year. And this we're talking about, 500 million, 20 times that number. But I would agree with Dr. Joshi that I think the government will pull out all the stops here in terms of delivery, and everyone will be focused on it in a way that we've never seen before. I think by 2021 it's possible. It will still not be enough to stop and get everyone vaccinated. There will still be some continuation, but I think getting 500 million people, or the right people, vaccinated will pretty much shut down a lot of this pandemic, assuming the immunity holds. So I'm just keeping my fingers crossed that the efficacy is as promised and we don't see a decline in coming months.
Dr. Jamil, what is troubling, of course, is the fact that, let me put it this way, what is one of the strengths, in a way, is the fact that we are now much more digitized. And therefore, there's a sense that the government can effect last mile deliveries, as we've seen with Jan Dhan Yojana, ensuring people get their monies in bank accounts. Do you believe, therefore, that makes us better equipped today than we were 10 or 20 years ago?
Yeah, certainly it does. But, you have to realize that at the end of the day, somebody has to take a syringe and needle in hand and go and vaccinate somebody. You can't do it online. So that's the trained manpower that has to be on the ground. And I'm optimistic that it will be there. I'm just sounding a cautionary note that that's a challenge that we have to live up to.
No, I think it's important to put these cautionary notes, Dr. Jamil, because my other worry, of course, and this is what I wanted to say earlier, is that, those who have influence, well-networked individuals will make sure that they get vaccinated first. And those perhaps who are out of the sort of so-called influential set will find it more difficult. Is that something that should concern us or not? Dr. Jamil?
Well, I guess to some extent, but that sort of class attitude has been there in India all the time. I mean, you will hear people say, "Oh, you got the Bharat Biotech vaccine. I got the Pfizer vaccine. It came through this channel or that channel." But let's not worry about that. I think we have a job at hand, and let's do it to the best of our ability.
Well, let's hope that is the next big challenge that we look at. If 2020 has been the year where we've had to overcome the virus, 2021 is the year when our delivery systems will be tested. Can we deliver, distribute, and ensure that the maximum number of people are vaccinated? I appreciate all my guests joining us on a day when the Prime Minister spoke to the Chief Ministers on this critical issue of vaccinations. Thanks all very much.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.